We continue to follow breaking news tonight. A suspected case of monkeypox in the city of Philadelphia. The health department says the case still needs to be confirmed by the CDC, which did confirm there is one case in the state of Pennsylvania.
Still, they say the risk of two Philadelphians is low at this time. We want to bring in our Dr. Mike Sirigliano. Dr. Mike, we bring in a lot of times for this kind of thing. We want to give people a real feeling of what we're seeing out there. What do we need to know right now about this case?
Well, number one, Chris and Dawn, the bottom line is don't worry, don't panic. This is much different than COVID-19. And what we're seeing that's intriguing is that normally you would be exposed to monkeypox through some infected animal or going to an endemic area, perhaps in Africa. What we're seeing here is transmission from person to person. Now, it's a lot harder to transmit this virus. It tends to be from close personal contact, skin to skin contact with bodily fluids. It can be spread from respiratory droplets, but much less likely than with COVID-19, where it's definitely a respiratory process. So this is something not to panic. We just need to be very on top of things and find out where it's coming from, do contact tracing, and we have treatment. We have antivirals and we have vaccines.
Well, Dr. Mike, what should people look out for? You were showing us a rash there. What are the symptoms? What do we need to know to prevent from getting it?
Well, it's a virus, and typically it can cause headache, muscle aches, fever, and as the disease progresses, you get a rash about 3 days after the onset of those symptoms. And the rash then can progress to these rather ugly-looking pustules, and after about a week or so, then they resolve. Now, the risk of dying is extremely low with this type of monkeypox. And again, cases that have come up, I think there's about 19 or 20 now in the United States, there are antivirals and there are vaccines. And what we need to do is contact trace and find out who they were in contact with, how the process occurred, how did they get the virus. And we're seeing, in many cases, close personal contact.
Okay, and I think many people are just a heightened awareness right now. But Dr. Mike, you said the most important thing, this is not another COVID. I think that's what people need to know, right?
Not another COVID. Look, if you get any kind of fever, muscle aches, or a rash, contact your healthcare provider. Do it right away. We test you and we deal with it. Bottom line.
All right, Dr. Mike, thanks for joining us. Appreciate it.
Thank you, doctor.